As Milwaukee is set to enter its next stage to reopening this week on Wednesday, what's happening in other states may have local health officials concerned. Joining me right now is Dr. Ben Weston, Director of Medical Services for Milwaukee County. Thank you for joining us. Do you have concerns about Milwaukee moving towards phase 4?
Absolutely. As we look around the country, as your previous story said, you can't help but see that the majority of states are going in the wrong direction. And even as we look throughout the state of Wisconsin, a large portion of our counties are going in the wrong direction. So far, Milwaukee County numbers are looking fairly promising. But that said, we've seen from all our neighbors that can change very, very quickly. So it's something we're keeping a very close eye on and are certainly concerned about.
Most definitely. And while we're not seeing in the thousands like many of the other hot spots across the country, can you say that you're seeing any hot spots here in the county that we need to be mindful of as we get ready to experience a holiday weekend?
Well, we know that COVID is throughout our entire county. When we look at our county dashboard, we see the circles over the last 7 days in pretty much every single census tract throughout the counties. There's some areas where it's more than others, but I think the take-home point is that COVID doesn't have boundaries. It is everywhere.
Definitely. And of course, we spent almost 50 days on what we would consider a lockdown when many of us could not get out. And now we're slowly getting out. What would be your word of advice as we head into the next few days towards that holiday weekend on what we all can do to make sure that this COVID-19 does not spread and our numbers go up again?
Yeah, well, as the question implies, policy is one thing, but individual decision-making is just as, if not more important. And so I think the key elements to think about are three: people, space, and time. So people, how many people are in your close circle? How many people are you closely interacting with? Keep that as small as possible. Ideally, just those in your household. But if you branch out a little bit, still keep it small. Space, how close are you to other individuals? Are you keeping your distance? Are you outdoors? Are you wearing masks? All critical elements to decreasing spread of COVID-19. And then time, if you have to be relatively close to somebody, can you do it for as short a time as possible? Passing somebody on the path in the park, very low risk. Sitting next to somebody for an hour in a restaurant, much higher risk.
Okay, we're looking at video right now from earlier in the week when everybody was getting out down at Bradford Beach, and we were telling people, get outside, be able to move around. But like you see here, they could be in their small group of friends, but yet around a whole bunch of people. How do you operate in those kinds of spaces and places?
Right. So in those kind of spaces and places, you still got to keep those three in mind. If you're going to be around a lot of people, spread yourselves out. Go to the far corner of the beach where nobody else is and hang out there. Minimize your time having to pass by people, but really maintain space. Even if it's outside, we know outside is safer, but even if you're outside, you got to keep distance.
Dr. Ben Weston, we always appreciate you making time for us again. Thank you so much.
Thank you.